Hello everyone, and welcome to this audio podcast. This audio podcast is part of the ShiZMode chapter. This audio podcast is part of the analysis and expose in robotics. This audio podcast is part of the as part of the shitstorm motley. This audio podcast is part of the jump off, and this audio podcast as part of the segment and V2, and this audio podcast is part of a Storm Robotics production. Today, and now looking at as part of this sort of audio podcast. This audio podcast chapter, I look at sort of the results, where the results are linked to the previous audio podcast in around the analysis. So just over 500 individuals were prescribed 2 or more nephrotoxic medicines, and around 65 were prescribed 3 or more. For both nephrotoxic and renal kidney dose adjustment medicines, just under 3,000 were prescribed 2 or more, and just under 1,200 were prescribed 3 or more. The most commonly prescribed nephrotoxic treatment modalities were listed as diuretics, followed by angiotensin converting enzyme inhibitors or ACIs. Relatively few individuals in amongst nursing and care home environs were prescribed an oral non-steroidal anti-inflammatory drug, and only one was prescribed the antibiotic nephrotoxic antibiotic gentamicin. That draws this audio podcast to a close. This audio podcast as part of the shitstorm chapter. This audio podcast is part of the analysis and expose and robotics. This audio podcast is part of the shitstorm and motley, and this audio podcast is part of the jump off. This audio podcast is part of the segment on V2, and this audio podcast is part of a Storm Robotics production.